Hello, I'm Fran, a vet at PDSA, and this is Jester. If your dog has been diagnosed with diabetes, I expect you're feeling a bit worried about them. You might also be feeling a little anxious that there's a lot to learn and consider. This video will help you understand what diabetes is and what you need to know if you have a diabetic dog. We will be covering what diabetes actually is, why it causes problems, why your dog might have developed diabetes, how it's treated, how often they need to visit the vet. We will talk about the practicalities of caring for a diabetic dog, the life expectancy of a diabetic dog, and the complications diabetic dogs might encounter. Diabetes means your dog can't control their blood sugar levels. Their sugar levels get very high, which makes them poorly. Normally, once a dog has eaten their food, the sugar from that food enters their bloodstream. These sugars aren't much use floating around in the blood, so insulin is produced to move them into the cells. For example, their muscle cells and brain cells. Sugar feeds cells and gives them energy. Once a dog with diabetes has eaten, sugar enters the bloodstream as normal, but it then stays in the blood because diabetic dogs can't produce the insulin to move it into their cells. This means diabetic dogs aren't able to give cells around the body the energy that they need. Untreated diabetes causes cells all around the body to starve. This causes serious illness and can be fatal. In the short term, diabetes causes thirst and hunger. This can progress to dehydration, collapse, and can even cause a diabetic coma, which could be fatal. In the long term, if diabetes isn't well controlled, it will start to affect the heart, kidneys, eyes, nerves, and blood vessels. The good news is, with careful treatment and monitoring, diabetic dogs can often live a normal, happy life, just with a slightly stricter routine. You might be wondering why your dog has got diabetes and whether it's anything that you've done wrong. The short answer is usually no. Unfortunately, some dogs just develop diabetes and it's not very often that we can pin a cause to it. However, there are a few factors that increase the chances of a dog developing diabetes. Obese dogs, female dogs, dogs that haven't been neutered, and dogs over 5 years old are slightly more likely to develop the condition. Dogs that have had a condition called pancreatitis in the past are also more prone to diabetes. Diabetes can't be cured, and diabetic dogs need treatment for the rest of their life. Treating a diabetic dog is a big commitment, but fortunately, if their condition is well managed, most dogs with diabetes will live just as long as they would without it. Treatment for diabetes involves three main things: insulin injections, a strict diet, and strict exercise control. The insulin injections, food and exercise all need to be at the same time each day, usually twice daily. Keeping things consistent is vital to make sure that we get the best control possible. For a more detailed explanation on how to treat diabetes, take a look at our video, Treating Your Diabetic Dog. This video contains details on insulin injections, feeding and exercise. It also tells you how to spot if your dog's blood sugar has dropped too low. Initially, your dog will need regular vet checks. Your vet will see your dog as often as necessary and until you're happy to manage their diabetes at home. They will then need regular veterinary monitoring for the rest of their life. Checkups are likely to be every few months once their diabetes is well controlled and you're confident giving insulin injections. This is a question I get asked from time to time, and the answer is unfortunately you can't control diabetes in dogs without medication. Left untreated, diabetes will most likely cause your pet to fall into a diabetic coma, which can be fatal. There's no getting around the fact that having a diabetic dog can be a big commitment. Your dog will need a strict routine, regular vet visits, lifelong medication, and some major lifestyle changes. The good news is, if you can manage looking after your diabetic dog, they often live a normal, happy life. If you're worried about the practicalities of looking after them, don't panic, you're not alone. Your vet practice will give you plenty of support. For some owners, the commitment of owning a diabetic dog isn't practical or affordable. It's really important to speak to your vet openly and honestly about your finances, lifestyle, and how you feel you'll be able to cope. Your vet will then be able to discuss all the options for you and your dog. Fortunately, most dogs with well-controlled diabetes enjoy a normal lifespan. This does, however, rely on them being kept a healthy weight and managed carefully with medication and a strict lifestyle. Complications that even dogs with well-managed diabetes tend to encounter include urine infections, skin infections, and cataracts in the eyes. Cataracts can develop very quickly, and it doesn't necessarily mean that their blood sugars are poorly controlled. For this reason, it's important to have your dog's urine and eyes checked regularly by your vet. In summary, you may be feeling overwhelmed by your pet's diabetes diagnosis. This is perfectly normal. Always speak to your vet and vet nurse openly and honestly about your concerns. Diabetes can't be cured, but it can be managed very well by a strict lifestyle and medication. Owning a diabetic dog is a big commitment, but it's very possible for them to enjoy a long, happy life if their diabetes is well controlled.